This is a real patient. These are real photos. And Kelly and I are going to walk through the entire patient journey from consultation until her last visit. Hi, guys. Welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. Today we have Kelly Herbert, our COO. And this is a special episode because we are going to go through an entire patient journey from start to finish. And Kelly's going to help walk us through that.
Thanks for having me back today. So yes, today we are going to be talking about case number 123 in case you want to head to our website and check out what we're talking about today. But this patient had quite the transformation. Before we get all the way to the end results, which is the most exciting part, we're going to talk about her initial consultation. So walk me through what you saw when patient 123 came in. What were you looking at in her photos?
Yeah.
And I've got them right here for you too.
Perfect. So before we even start looking at the photos, the consultation obviously starts with me getting to know a little bit about the patient. So I want to learn about them as an individual. Number one, because I like to know about people and their personal lives a little bit. I feel like that builds a connection. But it also sometimes helps me understand their motivation and where they're at in life for really what they're trying to achieve with these transformations. So that's first and foremost. And then I let the patient just kind of guide me through the reasons why they made that consultation. So again, their motivating factors, what they're seeing, how long they've been thinking about it. Has this been sort of a lifelong concern, or is this something recent? And also, was there any sort of inciting events or things going on in their life that really made them decide this was the right time to do this journey with me? And so after they've gone through with me their concerns, then we get a chance to go through the photos together.
Okay.
And I always ask, my patients, are you open to my suggestions? And I'd say that 95% of my patients say, yes, absolutely. That's why I'm here. I want your expert opinion. These are the things that I'm seeing, but what are you seeing? And then together with our really kind of beautiful photo display, it's really kind of a nice, eloquent way of going through their concerns. We can draw on those photos. We can go through all those areas that they have been sort of unhappy with or have areas of concern. And then together we can decide for them what is the best option, that combination of procedures for them.
Great. Okay, so what was patient 123 asking for when she came in? And was it the same thing that you saw when you looked at her face? Did those visions align?
Yeah, absolutely. Yeah. So she was a great example of where she said, I'm really not happy with any part of my face. And not because she didn't like who she looked like before, but she had just seen tremendous aging over the years. And she just wanted to revert back to that appearance of maybe 15, 20 years ago. And so she said, I'm open to suggestions. But really, she also kind of walked me through all the things she was seeing. And it really was from top to bottom, all the way from her hairline really down to her collarbone, which is everything that I do.
Okay, so kind of in looking at her pictures, it looked like she had quite a bit of deep creasing and wrinkles underneath her eyes, in the crow's feet area, some when she smiled. She had some texture issues with her skin. Were those things that you were able to point out in a certain order? So if she had said, well, I'm only ready to do maybe phase 1, or was she just open to everything? And really, what was the most important? Was it the facelift, or were fixing the eyes first going to help? Or was she really just ready to go with everything?
Yeah, so my system, because I think it's logical, it kind of walks patients through what they're seeing with the photos in a systematic fashion. I go from top to bottom. And again, so she was kind of concerned with every area of her face and her neck. And so we started by talking about her brows. We then evolved down to her eyes, both the upper and lower eyelids, then getting into the cheeks, the lip area, the chin area, the neck area, and kind of walked her through that entire really scenario of what that would look like with each one of those procedures to address those things that she was seeing. And I felt like, at the time, and she felt this way, that she was a good example of gravity really taking a hold of everything. And so we do have some patients that are maybe 40, 45, where they're just kind of noticing one or two things that have changed over the years. This particular patient, she was 62 at the time of her surgery. And so obviously she had seen changes in pretty much every part of those areas that we just described.
Great. And so kind of moving forward to the surgery and planning the surgery and that moment you were with her in the morning. When you were marking her up, were there areas that you were trying to preserve? Obviously, you said she was ready for a whole change, hairline to collarbone, but was there anything you were trying to keep uniquely her? Or was it just really let's wind the hands of time back?
Yeah, I mean, so I would say it's more the latter, but certainly there are certain anatomic features and borders and boundaries that we need to respect. So, for example, we don't want to change the ear position, right? We don't want to change the shape of the ear if that doesn't bother her. We don't want to change her hairline position. And really, what we're trying to do is we're trying to draw more attention to the beautiful features that have always been there, right? So, I think with this particular patient, you really see her eyes and her smile come to life after she was done healing. And so some people use the term, we're going to make you look younger, we're going to make you look refreshed. But I think what's oftentimes underutilized is making people actually look happier. And so she was a happy person
Yeah.
to begin with. But in that after photo, you see that happiness coming through because you're seeing those features that really do present a level of security, self-worth, and just being joyful.
I want to talk about the result. And I love what you were talking about when you were planning the surgery and how to wind the hands of time back. You mentioned having the same hairline when she was done, not changing the shape of her ears if she was satisfied with how her ears already looked. And in this case, patient 123 was. And I'm looking at the before and the after, and you'll be able to see that on our screen as well. Her hairline is exactly the same. Her ears are exactly the same. It's almost as if I see no evidence of any scarring. If you look at the after photo, if you didn't know her personally and you just saw her out shopping at a store at an event, you would have no indication that she's had any cosmetic surgery. She just looks naturally beautiful and really truly joyful. She looks so happy in the after picture. If you look at the before picture, she's smiling, she's trying to be happy, but so much of her face is hidden by that aging. So, I, what are you most proud of in this result? Because everything that you just said, I can actually see in that before and after transition.
Yeah, I would say to keep it simple, I'm proud of the harmony that we created, where it looks like each individual procedure that we did really kind of fits the other procedure or procedures that we did. So it all adds up. And I think that this also is a good highlight of the fact that patients will often tell me, hey, I don't want to do too much at once because I'm really afraid of looking different, looking weird. And I think there's this misconception that if you do, more than a couple procedures, that's going to take you over the edge, and you're going to look like you've had plastic surgery. And really, that only occurs if the patient didn't need that procedure. So now it's an overdone result, right? It
Yeah.
wasn't indicated in the first place. So long as it's an indicated procedure, you can do 4, you can do 8, and they're not going to look any less natural, in my opinion. So either, they didn't need the procedure, so now they're going to look weird or is, overdone, or the procedure, quite honestly, was just done terribly, right? So good example of that is with a facelift, pulling people in an unnatural direction, pulling them back, putting too much stress on the skin, brow lifts, lifting the brows too high for their face. Those are good examples of just not good results. So long as you can do the job well, and it's indicated and it's relevant for that particular person, they're going to look just as natural.
Great. Well,
Yeah.
before I get into my last question, let's tell our viewers exactly what she had done. So walk us through, because as you said, she partnered multiple procedures together. What gave her this result?
Yep. So what we saw in the photos, what she was telling me was she felt like her forehead was heavy. She felt like her eyes were hooded. And what's interesting is she had a temporal brow lift. So getting to the punchline there. But what was interesting about her and so many of my patients is they actually say that their forehead and their upper eye area feels fatigued at the end of the day. And that's always a tip off that they're having to over animate, hyper animate their forehead to get that heaviness of the brows off of their eyes. So we started with the temporal brow lift, which is a very common brow lift, form of brow lift that I do, which is really exposing that outer 2/3 of the eye because of heaviness, what we call lateral hooding, so the outside brow hooding the upper eyelid and not showing off the color of the eye. So we started there. She felt like she had extra skin of her upper eyelid that she didn't used to have, so we did an upper blepharoplasty. And then we also did a lower blepharoplasty to address the contour of her lower lid. So oftentimes people use the word bags. That's fat that's around the eye that people are supposed to have, but it's starting to show itself through. And typically when that happens, they also develop hollowness right underneath the bag. So we reposition that fat to fill in the hollowness and get rid of the fullness. Then we proceeded downward to an upper lip lift. She felt like her lip was getting longer. She wasn't showing enough of her teeth and or her lip. She was a perfect candidate for a lip lift. We addressed the lines around her lips as well as her eyes with some CO2 resurfacing. And then finally, we did a deep plane facelift and deep plane neck lift to address the laxity, the heaviness in her cheeks, her jawline, and in her neck.
Wow. Okay. So after all of that, tell us, what was her reaction when she achieved her final result?
She was like, "This is me. This is
Yeah.
this is what I remember."
Yeah.
And that's what I want to hear, right? Is oftentimes when patients come in or after surgery and they look at their before photos, they go, "Oh my gosh, I don't recognize that person. Like, how did that happen? When did this occur?" Right? It certainly isn't overnight. And so when they see that after result and then they compare it maybe to photos that they have on, their phone or, in photo albums from 15, 20 years ago, they say, "Oh my gosh, this is how I used to look." And that was her reaction.
Well, thank you. And thank you so much for joining us to discuss patient 123 today. You can find her on our website. And if you're interested in having a transformation yourself, please do call our office for a consultation. Thanks for joining.
And if you like what you heard today, please like the video and subscribe to our channel.